Good afternoon, it's Dr. Larson talking about COVID-19. A lot of things in the news. Lately, we'll talk a little bit about vaccine efficacy. We'll talk about the Delta variant and we'll talk about masking. So currently in Kittitas County, we are still below 50% of people vaccinated that are eligible for vaccination. That's those people 12 years in age and older. And we have that whole group of people in our community that are under 12 years of age that are not able to be vaccinated yet. It looks like it's possible that September might be an approval time for that vaccination for those younger children, but we just don't really know. The vaccine is still 88 to 98% efficacious at preventing serious disease and death. That includes the Delta variant, which we'll talk about a little bit. So all of our cases at KVH, all the people that have been hospitalized have been unvaccinated. Again, we're not seeing people in the hospital that have been vaccinated. Doesn't mean we're not having some vaccine breakthroughs. A vaccine that's 88% effective means that out of 100 people, you're going to have 12 people that are going to get breakthrough disease. And if you think about it, if you're vaccinated with a vaccine that's 88% effective and you're hanging out with a whole bunch of people that are unvaccinated, that pool of people that you're sitting around are just going to increase the number, the chances that you're going to have a vaccine breakthrough. So that's why we talk about masking. That's why we talk about masking indoors. It's still safe outdoors to be unvaccinated. As you probably saw from the CDC, some masking guidance changes, and today the governor made two big masking guidance changes. They are things that I agree with. So one is K through 12 schools, we have to be vaccinated, or so we have to be masked when we're starting K through 12 schools. I think that's quite possible to change as we move forward, but we know that the Delta variant is twice as infectious as the Alpha variant was, and it's now over 80% of our samples that we're sequencing in Washington State are the Delta variant. So what we're seeing is people are getting infected. People that are vaccinated are getting infected, and we still can transmit that to others. So we have a whole population, again, those 5-year-olds to 11-year-olds that are in elementary school that can't get vaccinated. So we have an increased transmissible disease, and we have a whole pocket of people that are unvaccinated. So K through 12 schools, everybody's going to be needing to be wearing masks. We'll see what happens with the Delta variant, but in our region, all of the counties in our region, which include Chelan, Douglas, Okanagan, Grant County, and us, we are all in high rates of transmission. Our rates here in Kittitas County have been going up slowly since July 4th, but we're going to soon have a big jump up. So my ask to you all is get vaccinated. The vaccines are safe. They're effective. They keep you from dying. Ultimately, the major goal of those vaccines are to keep us alive. So they're effective, they're safe, they're free, they keep us from dying. And because the Delta variant is increasing, we have increasing cases, if you were indoors with a whole bunch of people that are unvaccinated, please put a mask on. If you go to the grocery store where there are unvaccinated people, please put a mask on, because we are in a community where people are not wanting to wear their masks. So it's putting you at risk, it's putting them at risk. Things will change, but the key is you have control over this, and the control is the more people we can get vaccinated, the more we can get back to normal life. Take care, be safe. Thanks a lot. Bye.